Hello and welcome to Pregnancy Info. Today we are going to discuss about the test tube baby or IVF practice, its benefits, its risks, and its success rate. But first of all, we have to discuss that what is a test tube baby or what is IVF. A test tube baby is the product of a successful human reproduction that results from method beyond sexual intercourse between a man and a woman, and instead utilize medical intervention that manipulates both the egg and sperm cells for successful fertilization. The term was originally used to refer to the babies born from the earliest application of artificial insemination and has now been extended to refer to children born through the use of in vitro fertilization. The practice of fertilizing an egg outside of a woman's body, the use of the term in both medical and media. Facts about in vitro fertilization. In vitro fertilization can help achieve pregnancy when other treatments have not worked. The process involves fertilization an egg outside the body and implanting it to continue the pregnancy. 1% of babies born in the United States are conceived through IVF. There is a high chance of a multiple birth with IVF. Normal pregnancy. In a normal pregnancy, a male sperm penetrates a woman's egg and fertilizes it inside her body after ovulation. When a mature egg has been released from the ovaries, the fertilized egg then attaches itself to the wall of the uterus or womb and begins developing into a baby. This is known as a natural conception. However, if natural or unassisted conception is not possible, fertility treatment is an option. Now we will discuss the procedure or techniques used in this process. Techniques may differ depending on the clinic, but IVF usually involves the following steps. Number 1. Suppressing the natural menstrual cycle. The woman receives a drug, usually in the form of a daily injection for about 2 weeks, to suppress their natural menstrual cycle. Number 2. Superovulation. Fertility drugs containing the fertility hormone, follicle-stimulating hormone, are given to the woman. FSH makes the ovaries produce more eggs than usual. Vaginal ultrasound scans can monitor the process in the ovaries. Retrieving the egg. The eggs are collected through a minor surgical procedure known as a follicular aspiration. A very thin needle is inserted through the vagina and into an ovary. The needle which is connected to a suction device. This sucks the eggs out. This process is repeated to each ovary. In 2011, researchers suggested that collecting 15 eggs from the ovaries in one cycle gives the highest chance of a successful pregnancy. Frozen or donated eggs may also be used. Insemination and fertilization. The eggs that have been collected are placed together with male sperm and kept in the environmentally controlled chamber. After a few hours, the sperm should enter the egg. Sometimes the sperm is directly injected into the egg. This is known as an intracytoplasmic sperm injection or ICSI. Frozen sperm retrieved through testicular biopsy may be used. This is believed to be as effective as sperm, which are fresh, in achieving a successful pregnancy. The fertilized egg divides and becomes an embryo. At this point, some centers offer pre-implantation genetic diagnosis, which can screen an embryo for genetic disorder. This is somewhat controversial and is not always used. Embryo transfer. Sometimes more than one embryo is placed in the womb. It is important that the doctor and the couple wishing to have a child discuss how many embryos should be transferred. Normally, a doctor will only transfer more than one embryo if no ideal embryos are available. The transfer of the embryo is done using a thin tube or catheter. It enters the womb through the vagina. When the embryo sticks to the lining of the womb, healthy embryo growth can begin. Candidates. In vitro fertilization is ideal for women who have not been able to become pregnant through regular unprotected intercourse or after 12 cycles of artificial insemination. IVF can be an option if either partner has received a diagnosis of unexplained infertility. Other techniques such as the use of fertility drug or intrauterine insemination have not works. The women's fallopian tubes are blocked. Success rate in 2016, 26% of procedures led to a live birth. In 2010, the United Kingdom's National Health Service estimated that the chance of a live birth was 32.2% for women aged under 35 years, 27.7% for women aged between 35 to 37%, 20.8% of women aged between 38 to 39 years, 13.6% for women aged 40 to 42 years, 5% of women aged 43 to 44, 1.9% for women aged above 44 years. These statistics vary depending on where IVF is done. Other factors that may affect success. Apart from age, the likelihood of success depends on factors including how long you have been trying to become pregnant, the cause of the infertility, whether or not pregnancy or a live birth has occurred before, the strategy that will be used. IVF Predict provides an online calculator that can give some idea of how likely IVF is to be successful. But there are some risks associated with IVF. Side effects of medication. Some women have many reactions to the medications that are given during treatment. The possible side effects of IVF drugs include nausea and vomiting, difficulty breathing, irritability, hot flashes, enlargement of the ovaries, difficulty sleeping, abdominal pain. Bruising can also result from repeated daily injections. Health risks to the mother. Rarely the drugs can cause ovarian hyperstimulation syndrome. This happens when the ovaries overrespond to the gonadotrophin, so that too many eggs develop in the ovaries. Severe abdominal swelling and shortness of breath can cause pregnancy loss. The leading cause of pregnancy loss, whether in IVF or in natural conception, is an abnormal number of chromosomes known as chromosomal aneuploidy. Detecting aneuploidy in the egg or sperm before carrying out IVF or in an embryo before implantation may help increase the chance of a successful pregnancy. Multiple births. When more than one embryo is transferred into the womb, there is a higher chance of having twins, triplets, or more babies. Pregnancies with more than one fetus can result in preterm birth or low birth weight, double the mother's risk of developing diabetes, significant increase in the mother's blood pressure. The doctor may recommend that there should only be a single embryo transfer in women with a heightened chance of having twins. So this is all about in vitro fertilization or a test tube baby. If you find this video useful, then like it, share it, and also subscribe my channel. And if you want to give any suggestion, that you can do in the comment section.